The cancellation of USAID funding agreements has thrown a spanner in the works for HIV/AIDS prevention and treatment projects across the country. These funding cuts are a threat to the progress that has been made across different spheres in the fight against HIV/AIDS, especially in regards to our country's children. Let's talk now to the Executive Manager for Implementation at SANAC. This is the South African National AIDS Council, Dr. Nkhensani Nkhwashu. Dr. Nkhwashu, thanks for your time. We really do appreciate it. There are so many programs that exist in South Africa to deal with HIV prevention and treatment as a whole. And this morning, we're going to focus more on the face of HIV in children in our country. And I'd love for you to share with us what that face looks like. How many children are affected and infected with HIV? And I guess the important question, how many of those are actually on treatment?
Thank you very much, and good morning to all the viewers. Currently, as we stand in South Africa, indeed, we've got a huge number of children who are affected and also those who are infected by HIV. So looking at our 95, percentages, which are the global targets that has been set by the UNAID, you can see that children are still left behind. So when we look at those percentages, we find that the total number of children who are left behind for those who still need to be treated, we are sitting at 87% as a country. And for those who are supposed to be put on treatment, we are sitting at 79%. And out of those 79, only 72% of them, they have achieved viral load suppression. This is a low number compared to the adult population that we have, to those who are already on treatment. We know that currently as a country, we've got 30,000 children that we can't locate, where we don't know whether some of them are still alive and where they are coming from. And additionally, this is the number that we say it is the gap that will allow us to reach our 95% of children who are under 15 years old.
Dr. Nkhwashu, why are so many children not on treatment? What are the barriers?
The key barriers to, that plays a key role is that, remember, children rely on someone to take them to the clinic. While the adult populations, if you've got HIV or you are infected, you can walk into the facility and get services for yourself. So the barriers that we look at, it's mostly the social and the structural related barriers. Most of the children, you find out that, probably they've been left with a caregiver at home. And in most cases, what we have seen is that the caregiver sometimes is not even aware that that child is HIV positive. So then they rely on that specific caregiver. So hence we say, when we sum it up, we say they are affected by the social and the structural drivers that are out there, that, with some of them, they are also the economic factors. The mother work away from home. And also you'll find that, at home, the mother doesn't have enough money to go to the clinic. And additionally, in most cases, which is some of the issues that needs to be sorted out from the, from the service provision point of view, you'll find that the mother and the child have different dates that are expected to receive treatment on them. And the other one, we're looking and seeing that, the formulas that were used at that time, they were not really children-friendly. However, last year, the Department of Health sort of launched a formula that is children-friendly, and most of the children, they are currently being moved to that children-friendly formula.
Just a quick one before we talk about the impact of funding cuts, such as we've seen recently with the US. What happens, and I think this is a really important public service announcement, Dr. Nkhwashu, that if children aren't taken to healthcare professionals and aren't taken to the clinic, they aren't diagnosed and don't go on to treatment, that their outlook on life is severely impacted. So please just talk to us about the risks of not ensuring that children are tested and then receive treatment.
Thank you very much for asking that question, because indeed it is very important. If we've got children who are not tested and they are not taken to start their treatment, the impact is so huge, on the other side, on the provision of services by the department or also by our partners who are also receiving their treatment in the private sector. But specifically, it means that we increase the burden that we put in our health facilities. That child, because their status is not known, they present to the facilities with different types of diseases or, different types of chronic illness. So rather than focusing on treating the HIV, you find that mostly the healthcare workers, they will focus on treating this specific problem that the child has come up with clinic. I can give you an example that a child can present with diarrhea, at a constant basis. Meanwhile, we know that the underlying cause of that diarrhea is the presence of HIV, which if that child was put on treatment, the public care sector will not be spending these huge budgets, in treating the other diseases or the other communicable diseases that comes to an individual by being HIV positive. So that is where the huge impact is seen. And this impact, usually we see it with the increased numbers of people that needs to be seen at a facility level, and looking at our budget and all the budget cuts. Hence, we say it is good if your child is sick and you already know you are a mother who is HIV positive and you have been given a date for the follow-up of your child, that please present yourself at the facility with that child.
Just to close things out, Nkhensani, let's look at the impact of funding cuts, particularly those that are coming out of the US and those announcements made by President Donald Trump recently. We see a number of stories where their entire HIV program, treatments, prevention, public service, is basically wiped out. They're not able to function without that funding. Others relied on hybrid funding, so they might still have the prospect of being able to limp along with their services. But talk to us about what you are seeing as the direct impact of these particular funding cuts.
The key challenges that we are seeing on the ground is that South African National AIDS Council is a coordinating body for all the different structures that play a role, in the HIV response in the country. So where we are sitting as SANAC, we've got this opportunity of bringing, all these different funders and understanding to say, in terms of the response, where are you going to focus on, based on what we've got on our national strategic plan. Having highlighted that when we look at children, we still have, to close that gap of making sure that we reach that 95%, so that we've got children who grow up, who will have, an impact also on our economy in the future. We find out that these children, these 30,000 that I've highlighted, we call them that they are missing on treatment, or, they are missing on that continuum of care. And the key partners that we have involved in assisting us to locate those 30,000 children and to test more children so that we can put them on treatment, they come from these funded or these donor-funded communities. And majority of them, especially in the 27 districts in the countries, they are PEPFAR partners who were funded from the USAID, funding as a donor agency. And now, because they've been stopped, even though some of them have been told to continue, working, we know that already we're starting to see this huge impact that they have, because those are the same partners that we have requested that please help us identify these mothers. And, as much as health is there to provide the services, we know that the HIV burden does not only fall on the shoulders of government, but it falls also on civil society and also on the private sector. So these partners that were funded, they are the ones that were helping us, to go to the communities, to go to the workplace, like the farming area, yes, and the motor industries. They were the ones that, have resources to do and provide services outside of the healthcare environment.
Right.
And now, because they are no longer there, it means that that gap of 30,000 children that we are talking that they are missing, we will not be able to reach that. Even if we reach that, but it will be mostly with great difficulty. And I can tell you, they were on board. They were supporting us even in terms of collecting data, accounting. As South Africa, is one of the countries that have been highlighted even from World Health Organization, from UNAIDS side, that we fall within the countries that are in the first phase of, priorities in terms of, yes, getting children on board.